Have you ever woken up in the middle of the night, restless, sweaty, or with a strange feeling you couldn't quite explain? If you're living with diabetes, or even at risk, it's crucial to pay attention to what your body tells you after the sun sets. Nighttime can reveal key warning signs of blood sugar imbalances or complications that often go unnoticed during the day. These signs don't just disrupt your sleep, they could also be signaling deeper issues with your diabetes management. In this video, we'll uncover the top 7 diabetes nighttime signs you should know, warning signals that could dramatically affect your health if left unchecked. From restless nights to sudden discomforts, these signs not only interfere with your sleep, but might also be putting your well-being at risk. Stick around to learn how to recognize these symptoms and take control of your health. Number 1. Nocturia, frequent nighttime urination. Let's start with a common but often overlooked symptom, nocturia, or frequent nighttime urination. If you find yourself waking up multiple times during the night to use the bathroom, it might be more than just drinking too much water before bed. For individuals with diabetes, nocturia can signal elevated blood sugar levels. Here's how it works. When your blood sugar levels spike, your kidneys work overtime to filter and remove the excess glucose through urine. As a result, you end up making more trips to the bathroom. This symptom doesn't just disrupt your sleep, it can lead to serious fatigue and reduced alertness during the day, making everyday tasks feel like a chore. More importantly, it's a strong indicator that your blood sugar control may need some fine-tuning. So, what can you do? Start by monitoring your blood sugar levels regularly, especially before bed, to identify any patterns or spikes. Try to limit your fluid intake in the evening, particularly drinks like caffeine or alcohol that can worsen the issue. And if nocturia persists, don't ignore it. Speak with your doctor to rule out other potential causes like urinary tract infections or bladder issues. Remember, while nocturia might seem like a minor inconvenience, it's actually your body's way of alerting you to an underlying imbalance. By addressing it early, you can protect both your sleep and your overall health. Number 2. Night sweats. Another key nighttime sign to watch for is night sweats, waking up drenched in sweat, even if your room isn't overly warm. For people with diabetes, this can often be a sign of nocturnal hypoglycemia or dangerously low blood sugar levels during sleep. When your blood sugar dips too low, your body reacts with symptoms like sweating, shakiness, and even a racing heart as it struggles to restore balance. There are several potential causes of night sweats. These include certain diabetes medications or insulin treatments, rigorous evening exercise, or an imbalanced dinner that doesn't provide enough slow-releasing carbs to stabilize blood sugar overnight. Whatever the cause, the consequences are more than just discomfort. Repeated episodes of hypoglycemia can disrupt your sleep and, if untreated, pose a serious risk to your health. To manage this, start by regularly checking your blood sugar levels in the evening and before bed. You might need to tweak your meal timing or composition, focusing on foods that provide steady energy throughout the night. Avoid heavy exercise right before bed, and always keep a quick source of glucose, like tablets or juice, on your bedside table in case of an emergency. If night sweats persist, it's important to talk to your doctor. They can help fine-tune your medications or treatment plan to prevent these episodes. While it's easy to dismiss night sweats as a fluke, they're your body's way of signaling that something needs attention. Don't ignore the message. Number 3. Restless leg syndrome, RLS. Have you ever felt an uncontrollable urge to move your legs while trying to sleep, often accompanied by uncomfortable sensations like tingling, crawling, or itching? This could be a sign of restless leg syndrome, RLS, a neurological condition that becomes more common in people with diabetes. For diabetics, RLS is often linked to peripheral neuropathy, which occurs when prolonged high blood sugar damages the nerves, particularly in the legs. RLS can make falling asleep a nightly struggle, as the symptoms tend to worsen in the evening and nighttime hours. The constant need to move your legs disrupts your rest, leaving you feeling fatigued and less focused during the day. To manage RLS, the first step is keeping your blood sugar levels within the optimal range, as better control can prevent further nerve damage. Lifestyle adjustments can also help, cutting back on caffeine and alcohol, which can exacerbate symptoms, and engaging in moderate exercise to improve circulation and nerve health. Simple remedies like warm or cool packs, leg massages, or relaxation techniques such as meditation can ease the discomfort and help you unwind. If these steps don't bring relief, talk to your doctor. Persistent RLS might need further evaluation or specific treatments to address nerve-related issues. Remember, RLS isn't just a nuisance, it's your body signaling that your nerve health might need extra attention. By addressing it, you're not just improving your sleep, but also safeguarding your overall well-being. Number 4, sleep apnea. Let's talk about another serious nighttime issue, sleep apnea, a sleep disorder where breathing repeatedly stops and starts during the night. While anyone can experience sleep apnea, it's particularly common among diabetics, especially those struggling with obesity. Excess weight can cause airway blockages, making it harder to breathe and contributing to insulin resistance, which worsens blood sugar control. For someone with sleep apnea, nights are filled with frequent awakenings, even if they don't realize it. This disrupts sleep quality, leading to poor oxygenation, fatigue, and an increased risk of complications like high blood pressure and difficulty managing diabetes. Sleep apnea doesn't just steal your rest, it can also make controlling your blood sugar significantly harder. So, what can you do? First, if weight is a factor, even modest weight loss can reduce symptoms and improve both sleep quality and blood sugar levels. For moderate to severe cases, a CPAP, continuous positive airway pressure, machine can be a game changer, keeping your airway open throughout the night. Simple adjustments like sleeping on your side instead of your back can also help reduce airway blockages. And be cautious with alcohol and sedatives before bed, as these can relax throat muscles and worsen apnea. If you suspect you have sleep apnea, don't wait, speak to a healthcare provider about a sleep study. Addressing this condition is not just about better sleep, it's about taking control of your health and reducing the risks associated with diabetes. Number 5, nighttime hypoglycemia, low blood sugar. One of the most critical nighttime signs to watch for is nighttime hypoglycemia, which occurs when blood sugar levels drop too low during sleep. This condition can manifest through unsettling symptoms such as night sweats, vivid dreams, or waking up with a pounding headache. While these symptoms are troubling, severe cases of hypoglycemia can lead to seizures or even unconsciousness, making it essential to recognize and address this issue promptly. The causes of nighttime hypoglycemia often include mismanaged insulin doses, skipped meals, or excessive physical activity earlier in the day. To prevent these dangerous dips in blood sugar, start by regularly checking your levels before bed. If your blood sugar trends on the lower side, consider having a small, carbohydrate-rich snack, like a slice of whole grain toast or a handful of nuts, to provide a steady source of energy overnight. It's also crucial to work with your doctor to adjust your medication or insulin timing if needed. Keeping a fast-acting glucose source, like glucose tablets or juice, on your bedside table ensures you're prepared if an episode strikes during the night. Additionally, educate your family or close friends on recognizing and managing severe hypoglycemia. They could play a vital role in your safety. Nighttime hypoglycemia isn't just a disruption to your rest, it's a serious health risk. Taking proactive steps to manage it can help you sleep more soundly and protect your overall well-being. Number 6. Nighttime frequent thirst. Waking up in the middle of the night with an unquenchable thirst isn't just inconvenient, it can also be a red flag for elevated blood sugar levels. For individuals with diabetes, excessive thirst during the night, known as polydipsia, often occurs when high blood sugar draws water out of your cells, leaving your body dehydrated. To make matters worse, the increased urination that comes with high blood sugar further depletes your hydration levels, creating a vicious cycle of thirst and bathroom trips. This constant need for water not only disrupts your sleep, but can also leave you feeling fatigued and dehydrated the next day. Over time, it's an indicator that your blood sugar levels may not be as stable as they should be. To manage this symptom, focus on maintaining steady blood sugar levels by monitoring them regularly and following a balanced diet. Spread your fluid intake evenly throughout the day rather than overloading in the evening, which can help reduce the need for nighttime drinks. Cutting back on caffeine and alcohol is another smart move since both can contribute to dehydration and worsen blood sugar spikes. If nighttime thirst persists, it's worth discussing with your healthcare provider to identify any underlying issues and adjust your treatment plan as needed. By addressing frequent thirst at night, you're not just improving your sleep, but also taking another step toward better diabetes management and overall health. Number 7. Nighttime cramps. Few things disrupt a good night's sleep like a sudden, painful muscle cramp in your legs. For diabetics, nighttime cramps are often tied to blood sugar imbalances, reduced circulation, or even diabetic neuropathy. These involuntary muscle contractions can be sharp and intense, leaving you wide awake and uncomfortable. The causes behind these cramps can vary, but poor blood sugar control and nerve damage are common culprits. Reduced circulation to the legs can also contribute, particularly if diabetes has already started to affect your vascular system. While these cramps may seem like a minor inconvenience, the repeated disruption to your sleep can lead to fatigue and decreased quality of life. To manage nighttime cramps, start by focusing on maintaining stable blood sugar levels through regular monitoring and a well-balanced diet. Stretching exercises, especially targeting your legs, before bedtime can help loosen up muscles and improve circulation. Staying hydrated and ensuring you get enough essential minerals like magnesium and potassium can also reduce the frequency and severity of cramps. Warm baths or heating pads before bed can relax tense muscles, while wearing supportive footwear during the day can improve overall leg health. If cramps persist despite these efforts, consult your doctor to rule out other causes and discuss possible treatments. Don't dismiss nighttime cramps as a simple annoyance. They're often your body's way of signaling an underlying issue. Addressing them can improve not only your sleep, but also your overall diabetes management and well-being. Recognizing these nighttime signs of diabetes early can make a significant difference in your health. Symptoms like frequent urination, night sweats, restless legs, or muscle cramps aren't just minor inconveniences, they're your body's way of signaling that something needs attention. By addressing these issues proactively, you can improve not only your sleep quality, but also your overall diabetes management and well-being. If you've noticed any of these symptoms, don't ignore them. Start by monitoring your blood sugar levels regularly and making lifestyle adjustments where needed. Most importantly, consult with your healthcare provider to develop a tailored plan to address these concerns and optimize your treatment. Remember, your health is in your hands. If you found this video helpful, please like, share, and subscribe to our channel for more informative content on diabetes and overall wellness. Together, let's take steps toward a healthier, more restful life.